look at the deformities in case of the rheumatoid arthritis. So the questions we would want to ask is what is a swan neck deformity, and the other one is what causes the trigger finger. So we'll find out these answers and learn in detail. So to begin with, firstly there is the boutonniere deformity. So boutonniere deformity, it means the flexion of the PIP. So it is nothing but flexion of the PIP joint, and this is with the hyperextension of the DIP. With hyperextension, this is hyperextension of the DIP. Next one is the swan neck deformity. Swan neck deformity. So swan neck deformity is nothing but it is the hyperextension of the PIP. Hyperextension of the PIP, and this is with the flexion. This is with the flexion of the DIP joint. Flexion of the DIP joint. Next, we look at the Z line. Next, there is a Z line deformity. Z line deformity. So Z line deformity is nothing but a radial deviation. It is a radial deviation, and this is of the wrist. Radial deviation of the wrist with the ulnar deviation of digits. There is ulnar deviation of the digits. So let's recap. So we saw the three disorders, that is the Boutonniere's deformity. It means that there is a flexion at the PIP. Flexion at the PIP, and there is a hyperextension of the DIP. Next comes the swan neck deformity. The swan neck deformity is nothing but there is a hyperextension of the PIP, whereas previously there was flexion in PIP in case of the Boutonniere deformity. Here there is hyperextension of the PIP as well as the flexion of the DIP. Next comes the Z line deformity. The Z line deformity is nothing but a radial deviation of the wrist and the ulnar deviation of the digits. Next, we are going to look at there is eversion. Next, we are going to look at the eversion at the hind foot. Eversion of the hind foot, that is nothing but the subtalar joint. Subtalar joint. Next, there is also the hallux valgus as well as the hammer toe. Then comes the windswept deformity. Windswept deformity. So here there is a valgus deformity. There is a valgus deformities, and this is nothing but of the toes in one foot. The toes in one foot and varus in other foot. Next, there is also trigger finger, and trigger finger is due to the flexor tendon synovitis. So let's just recap. So we discussed the eversion of the foot. So the eversion of the hind foot, it refers to involving the subtalar joint, and there is also hallus valgus and the hammer toe. Next, in windswept deformity, it includes the valgus deformity of the toes in one foot and the varus in the other foot. Next comes the trigger finger. Trigger finger is due to the flexor tendon synovitis. So next, there is another characteristic that is known as the piano key. Piano key. So piano key movement. So piano key movement, this is of the ulnar styloid. Ulnar styloid. So to recap, the piano key movement in the ulnar styloid. So now let's answer our questions. The first question we asked was, what is meant by the swan neck? Swan neck deformity. So swan neck deformity is nothing but there is hyper extension of the PIP. This hyperextension of PIP, and this is with the flexion of the DIP. Hyperextension of PIP with the flexion of DIP. The second one, the next question we asked was what is meant by the trigger finger. So trigger finger means it is due to the flexor tendon. It is due to the flexor tendon synovitis. Flexor tendon synovitis. Now let's recap. So we discussed the swan neck deformity. It is a hyperextension of the PIP with a flexion of the DIP. Next, the trigger finger. It is the flexor tendon synovitis. So this was about the deformities of the rheumatoid arthritis. To learn and grow daily, please do subscribe.